Today, we will learn about inflammatory roles cytokines play in COVID-19. The severe acute respiratory syndrome coronavirus 2 emerged in December 2019. It is the cause of coronavirus disease known as COVID-19. It first emerged in China and quickly spread across the world. On March 11, 2020, the World Health Organization classified COVID-19 as a pandemic. As of August 10, 2020, there are 20 million cases and close to 730,000 confirmed global deaths. There is no available vaccine against this deadly disease. 157 vaccine candidates are undergoing development by academic labs and industry. Those candidates include live attenuated vaccines, inactivated vaccines, subunit vaccines, such as virus-like particles, viral vectors, DNA and RNA vaccines. 5 of the vaccine candidates have reached the final Phase 3 efficacy trials. Genetic vaccines use one or more of the coronavirus's own genes to provoke an immune response. Whole virus vaccines use a weakened or inactivated version of the coronavirus to provoke an immune response. Viral vector vaccines use a virus to deliver the coronavirus genes into cells to provoke an immune response. Normally, viral particles or invaders enter the body through the mouth, nose, and the eyes. SARS-CoV-2 virus primarily affects the respiratory system, although other organ systems are also affected, including the heart and the blood vessels, the liver, kidney, and the brain. Once the virus enters the body, let's see how the immune system responds. We focus on the moderate and severe cases of COVID-19. One of the very first responses is the production of interferons, which are cellular factors that the body makes in response to viral infections. At least 80% of those infected mount a typical immune response. Immune cells are activated to eliminate the virus by producing inflammatory cytokines. Here's a depiction of the virus entering through the epithelial barrier, immune cells such as macrophages producing inflammatory cytokines and fighting off the virus. In the severe cases, acute respiratory distress syndrome is the leading cause of mortality in patients with severe disease. Cytokine storm is associated with the ARDS and occurs as a result of uncontrolled inflammation with the result of hyperinflammation. Lower levels of interferons, and in fact, administration of interferons has been reported to be an effective treatment. This is a CT scan of a 77-year-old man's lungs 5 days after symptom onset. On the right is a scan 20 days after symptom onset. Arrows indicate bilateral fluid buildup in the lungs. This really shows the lung damage that's caused by COVID-19. The patient died 10 days after the final 20-day scan. Severe infections have many more secreted cytokines. What are cytokines? Cytokines are small soluble proteins which play a role in the intracellular signaling and the immune response. They're secreted by the immune cells and circulate in the body. They're able to induce responses including upregulation and downregulation of genes, innate and adaptive immune responses, inflammation, and many other processes. In other words, cytokines are used as messengers to coordinate an immune response. There is a certain baseline of cytokine concentration in healthy adults, but in COVID-19 cases, one's cytokine profile increases. Now, onto the cytokine storm that was mentioned earlier. It occurs when the immune system responds too strongly. Just like in a rainstorm occurring in the middle of the ocean, we get big waves. In a cytokine storm, hyperinflammation instead is observed. A study was performed on patients in Wuhan, China, that found molecules responsible for the cytokine storm. They looked at the differences between the levels of cytokines in healthy patients, non-ICU COVID-19 patients, and ICU COVID-19 patients. This study found these cytokines to be responsible for the cytokine storm. We will focus on IL-1 beta and IL-6. Pyroptosis and lymphopenia is a recipe for destruction in COVID-19. As we just saw in a previous study, there are elevated levels of IL-1 beta in patients with COVID-19 disease. Lymphopenia, or depletion of lymphocytes, is observed in COVID-19 patients' blood. Lymphopenia and elevated levels of IL-1 beta are characteristics of pyroptosis. Pyroptosis is a type of an immune death. Therefore, pyroptosis may deplete patients' lymphocyte reservoir, reducing patients' ability to fight off the virus. Pyroptosis was also previously found in SARS-CoV. IL-6 and COVID-19. IL-6 promotes T-cell expansion and activation and B-cell differentiation. IL-6 also inhibits induction of regulatory T-cells or white blood cells that dampen the immune response. IL-6 promotes self-reactive pro-inflammatory CD4 T-cell response. All of those characteristics taken together may be some of the reasons of the deleterious effects of the cytokine storm. That's why it's so important to wash your hands, keep social distancing, and also wear a mask.